Hello everyone and welcome to our channel where we always try to bring you the latest information beneficial to your daily life. Today I will give you some advice on what to watch out for if you are traveling and need medical attention or have a health emergency. Once again, I will speak about my experience. Recently, my wife's foot got twisted while walking, and she needed to go to a hospital emergency. We live in a beautiful, picturesque small town surrounded by mountains in the state of Boyacá, Colombia. The town is a tourist place visited by many people every weekend. The nearest hospital here is about 9 kilometers from where we live, which is about 5.5 miles. When we got to the hospital's emergency room, there was only an elderly lady waiting there and no hospital attendants. My wife and I were waiting for about 20 minutes and no nurse nor doctor came. In the meanwhile, the lady that was waiting there before us decided to leave. Obviously, she got tired of waiting. Then I started walking through a corridor to look for some medical staff. I found a group of 4 nurses standing in a hallway just casually chatting. I told them that my wife had a great pain and has been waiting in the emergency room for almost half an hour, and she needs an immediate attention. They just passively looked at me and did not respond to my comment. Instead, they just continued chatting with each other. I went back to my wife in the waiting room, and about 5 minutes later, a nurse came to attend to my wife. The rest of my wife's medical consultation went well. But here is what she has to say about what she saw in the other part of the emergency section.
Hi, I'm going to tell you about an experience I've had today. I had a twisted ankle and therefore I had to go to a hospital near where I live.
Al hospital más cercano que queda donde yo vivo.
The experience was horrible, terrible.
Terrible.
Because when you go to a hospital's emergency room, you expect a quick service and a good quality service.
Y de muy buena calidad.
When we got to the hospital's emergency room, the nurse told us to have a seat and that they will take care of me right away. We were sitting there for half an hour and nobody came to attend to me. In front of us there was a patient sitting and crying, and nobody, no medical staff was coming to tell us anything. My husband started getting upset and he got up to look for someone to help us. The nurses and a doctor were together in a main reception area, not worried about anything that was going on around them. The patients there were sitting and taking their medication. The attention to the patients there was precarious, very, very bad. What would it be like if it was a case of a real serious emergency? This leaves a lot to think about and a lot to talk about. That we have a health system that is very precarious, very bad. It is a horror to come to an emergency room with an intolerable pain and be told by the staff there to sit down and wait, and nobody comes. My husband was very upset by the lack of medical attention Anyway, this leaves us to reflect on the health system that we have. A seriously ill patient comes to an emergency room and ends up dying while waiting for attention.
In addition to that, later I had conversations with other people in our neighborhood, including a taxi driver who occasionally brings people to this hospital, and they all had sad experiences there. Experiences too numerous to be mentioned here in this video. Most people living here are farmers, humble people who have no alternatives and depend only on this particular hospital. The only alternative people here have is medical centers and hospitals in the city of Tunja, which is about 30 kilometers or 19 miles far from this hospital. In a car, it takes about 50 minutes to get there. But of course, most farmers do not have cars, and they would have to take a taxi, which of course would be very expensive for them. Or they would have to take a bus, but unfortunately, buses don't run in the evenings or at nights. Now, I must say that this is not the only place that needs a much better medical attention for patients. I had a similar situation in Europe and in the United States. So, in summary, the proper medical care is really a global issue and not just a local one. Yes, there are some exceptions in a very few countries, such as Norway, Sweden, or Switzerland. Given this fact, why other countries do not follow their suit? Is it a question of economy? If so, then we need to bring the governments into the picture. Shouldn't the governments organize their political priorities and serve their people as they are supposed to do? This is a question that all of us are facing. And what are we going to do? If we think that we cannot do anything to change the situation, then nothing will change. But every one of us can contribute a little to make a big change. So let us support good, competent politicians.
Thank you for watching this video, and to see more of our informative, educational, and up-to-date videos, please subscribe to our channel, and also please press on like. And of course, if you have any comments or questions, please write them below this video.